Frozen shoulder could be the result of an old injury, such as fracture of the arm bone, shoulder blade, or collarbone, or it could be because of the damage into the joint capsule of the shoulder, or it could be due to repetition or overuse injuries such as bursitis or tendonitis of the rotator cuff, which now it's leading into or causing inflammation. That inflammation will lead to pain, and of course the pain will cause immobilization or reduction of the range of motion, which all this starts to create frozen shoulder. The duration of frozen shoulder could be somewhere between 2 to 9 months, which starts with the shoulder pain, and gradually, if it gets ignored because of the pain and immobilization or reduction of the range of motion again, it turns into more spasm, tension, contraction of the connective tissues, which leads to frozen shoulder. And when it gets to that point, it would be very difficult to treat it. It's going to take a while for the shoulder to release, and of course the patient's going to be in a lot of pain and discomfort until we can reverse that. So the purpose of this video is to show you exercise and stretches to prevent that from happening, or if you've been diagnosed with frozen shoulder, you can do these exercises and stretches for better recovery, faster result, and obviously to reverse all that process of frozen shoulder. Okay, let's begin. You stand with your shoulders relaxed, and what you will be doing is that you're gonna rotate your shoulders forward, and you do this about 5 to 10 times, and then you're gonna rotate them backwards. And basically this is how you do it. You rotate them forward, you do them about maybe 5 to 10, and then when you're done, you relax your shoulders, and then you're gonna rotate them backwards. What it does, it loosens up the joint capsule and the muscles around the rotator cuff. The next exercise is you relax your shoulders. You're gonna raise the arm on the affected side, and you're gonna bring it as high as you can bring it up, and then you're gonna bring it down, and you're gonna repeat this for about 5 to 7 times, or as you are tolerating it. The whole idea is to open up the joint capsule of the shoulder. You do this for about maybe again 5 to 7 times. When you are done, you're gonna be doing the same thing forward. If you have a hard time doing this, use the other hand for assistance just to bring it up. And when you are up, sometimes it's good to hold it for a few seconds and then slowly bring it down. Now what you do, you bend your elbow, you bring it as high as you can bring your shoulder up, and you're gonna be bringing it across your chest and all the way back. Same thing, you're gonna be doing this for about 5 to 10 times, or as you can tolerate it. And then when you're done, you're gonna be holding it in the horizontal line or as high as you can bring it up, and then you're gonna bring your hand down and up. Same thing, you'll be repeating this 5 to 10 times, or as you can tolerate the movement. Again, it opening up the joint capsule of the shoulder, and also stretches the rotator cuff ligaments. Right? You're gonna raise your arms as high as you can bring them up, and then you're gonna bring them into the middle, and you're gonna take them back and down. Up, you bring it across, take them back and down. You're gonna be doing this for about 5 to 10 times again, or as you can tolerate it. The next one, you're gonna bring your arms up again, and you're gonna do small circles. You're gonna do them clockwise. Again, 5 to 10 times, and then you're gonna do counterclockwise. Make sure your shoulders are relaxed. Again, you do this as you are tolerated. If you can't bring it to this height, just bring it a little bit lower as you are comfortable. But make sure you keep rotating them for about 5 to 10 times. For the other stretch, you basically, let's say if this is the affected shoulder, with the good hand, you're gonna grab the elbow and you're gonna bring it as high as or to the opposite shoulder as much as you can. You just hold it for about, I would say probably 10 to 15 seconds, and then relax it, and then bring it back again. Hold it for about 10 to 15 seconds and relax it. You'll be doing this for about 5 to 10 times. Every time you hold it for about 15 to 20 seconds. What it does, it stretches the deltoid muscles and the ligaments on the side of the shoulder. For the next exercise, you need a dumbbell or you need a can of soup. Somewhere between, this one is about 5 pounds. You can have it as low as 3. Basically what you want to do is that you're going to grab the weight and you're going to go back and forth like a pendulum. And you're going to go side to side. Just relax your shoulders. Let the gravity to pull your arm down. You can go rotation like clockwise and counterclockwise. And you're going to be doing this for about maybe a minute. And again, do all directions, going back and forth, to the side, rotation. You can go diagonal if you like, and just keep doing this. And at the same time, just relax your shoulders. Let the gravity to gap the joint between the arm and the shoulder. The other exercise, you try to touch your shoulders and you're going to be rotating your elbows. Again, you rotate them to the front and then you're going to be rotating them to the back. For each front or back, you do 5 to 10, and then you're going to do 5 to 10 forward. And again, what it does, it mobilizes the tendons, connective tissues in your shoulders, opens them up and warms up your shoulder and increases the range of motion, and also increases the blood flow to the area, which helps with the recovery. The other movement, you're going to bring your shoulders forward and back. Just like this. You're going to do 5 to 10 times. And again, it mobilizes your shoulder joint, your collarbone, and your shoulder blade as you're doing this. Make sure you stand and with your shoulders relaxed, and you're just gonna roll your shoulders back and front for about 5 to 10 times. The other stretch, you bring your arm across your chest as far as you can. Use the other hand, you kind of press it in. And if you can go further, go all the way. And if you can, just hold it there. Let the muscles in the back of the shoulder to stretch, and then hold it for about maybe 10 to 15 seconds, and then relax it, and then repeat it again. Basically, you're gonna bring your arms across your chest. With the other hand, you press it in just to stretch this muscle. For the other stretch, you basically bend your elbows to 90 degrees, and then you're gonna go up and down. You go, make sure you go all the way back as you're doing them, and all the way front. Again, as your shoulder can handle it, but the movement, it's going to be like this. Another exercise, again, you bend your elbow to 90 degrees and you're going to be rotating it in and out as far as you can do it. Again, you're going to be doing this for about 5 to 10 times. And what it does, it mobilizes the shoulder joints. rotator cuff, connective tissues, and also increases the blood flow to the area. There you go. Those were the exercise and stretches for your frozen shoulder. If you feel that your shoulder pain is turning into a frozen shoulder, you should do these every day, at least twice a day. And obviously make sure you seek professional help for proper diagnosis for your shoulder pain. And if it was in fact frozen shoulder, these exercise and movements will improve your condition a lot faster with a better result, but you have to do them on a daily basis, at least twice a day. Till next video, we'll see you later. If you're finding this video helpful, make sure you subscribe to this channel for more tips and videos like this.